So today I thought I would talk about a really common question I get asked all the time, and that is, what is the difference between physiotherapy and chiropractic work? So the way I see my job as a physiotherapy is that we are responsible for getting your body functioning at its best state. So whatever that might look like for the individual. So we usually work with each individual person, taking them from whatever state they might be when they come to see us. So sometimes it's someone who's actually injured, so they've got a pain or a stiffness or loss of function or limited in some way. And then we try and get them back to their normal state, and then even take them beyond to hit whatever goals that this person is wanting to do. So whether it not be going back to playing sport or going off for a 10-kilometer run or a marathon, whatever their goals are, we try and get them to that level. So sometimes people can present with injuries that come from a little niggle, or it might be from a trauma, like you've fallen over or you've had an accident and then there's an injury there, and then we need to work on that body to get it back to normal. So usually we do it through a few different ways. So soft tissue therapy, including massage, is one way. We also do a bit of dry needling. Oftentimes we also can use some electric modalities like ultrasound or interferential waves to help with the healing process and the pain management as well. We can do stretching, and we also do joint mobilization and even manipulation at times. Then there's the other arm, where we actually use exercise rehabilitation to actually help the muscles to work better, to move the joints so that the whole body is moving better. So a lot of the times we're looking at a smaller area or smaller joints, and then we're making sure they're working well, and then marrying it up with how the whole body is moving as a whole. So say for example someone's going for a run, we'll make sure that, say they had an ankle sprain, that the ankle joint is all healed up and strong by itself, but then we want to make sure that this person is then running with the right technique, and they haven't learned to compensate or overcompensate with other areas, and then they're maybe limping a little bit when they start running. So we want to look at it as a whole as well. I've talked to some of my chiropractic friends just to kind of see what their take of chiropractic work is, and this is how they've chosen to describe what they do. They basically look at the spine and how the spine is functioning at each different level, and then they want to optimize that with the nervous system. So they want to marry up the spine's function with also getting the most out of that nervous system and being able to connect the two better. So they do this through doing adjustments and various other techniques to just try and improve the way the spine and the nervous system communicate. So it's a bit more of a also a holistic kind of view, but it's a bit different sort of angle on it, where they kind of rely more on the relationship between the spine and the nervous system. Whereas physios, we tend to take all the joints, the muscles, all the soft tissues, how they speak to each other, and then as a big whole as well, and how someone's moving. So hopefully that demystifies a little bit about the two different professions. I think there are great aspects to take away from both of them. So let me know what your thoughts are. If you've got any questions or comments or feedback, I'd love to hear it.